Hello everyone, and thank you for attending our virtual presentation of our project, Woodview Medical Center. My name is Zach Detterman, and I am one of the group's architecture students.
Hello, my name is Lexi and I am the group's interior design student.
Hello, my name is Zach Ruprecht, and I'm the group's landscape architect.
Hi, my name is Allison Morgan, and I'm also in architecture.
The city of Adel and its surrounding communities are underserved regions for healthcare services. Currently, the closest emergency department is located in West Des Moines, Iowa, a 20-minute drive away. Additionally, there's a lack of preventative care in the area. According to the American Medical Association, preventative care declined during the height of the COVID-19 pandemic. Child vaccinations were down by 60%, mammograms were down by 80%, and colonoscopies were down by 90%. As a result, healthcare professionals promote telehealth to offer greater flexibility in healthcare and accommodate everyone's busy schedules. As Adel's population grows, demand for healthcare services will only increase. Staff wellness is essential, and it heavily influenced our design. In the United States, 83% of hospitals provide workplace wellness programs, 63% offer health screenings, and 31% provide health coaches. To aid in staff wellness, we have implemented comprehensive programming into our building, such as an indoor fitness center, decompression rooms, and break rooms, to name a few. Other design drivers go beyond staff wellness, including patient privacy, natural views, and daylighting strategies. We also use sustainable materials and include stormwater retention and filtration systems in our project. We aim to empower individuals with preventative strategies for wellness by programming fitness and nutrition classes, providing healthier food options throughout the building, and including telehealth rooms to offer connections between patients and remote specialists to encourage preventative care.
As we began to develop our concept, we broke down elements needed to create our intended experience for all users. Notably, some critical aspects were creating a nurturing, connected, and secure environment that provides nourishment, balance, restoration, privacy, and comfort. These aspects together will allow us to create an efficient and welcoming healthcare facility. With sustainability as one of our design drivers, we want to incorporate sustainable and durable materials throughout our design. Adel's brick plant allowed for locally sourced materials in addition to wood, stone, and concrete sourced regionally. For the interior materials, it was essential to have durable and cleanable surfaces, such as a laminate wood veneer and bleach cleanable antimicrobial upholstery. For flooring, vinyl sheeting is used in high-traffic areas, while LVT planks cover personal spaces. Any wall covering within our building will be Type 2 vinyl wall covering, and paint colors associated with different departments aid in wayfinding.
Our site is conveniently located directly off of Highway 169. It is 5.66 acres and has 20 feet of elevation change, with slopes ranging between 5 and 15%. The site is currently agricultural and woodland, and we aim to keep it this way to provide natural views to our building occupants. Our medical center is accessed via Meadow Road and has multiple points of entry. For patients, staff, and visitors, primary access splits into 2 roads to access either the main clinic entrance or the emergency department. There is also a service drive meant to deliver food, medical equipment, and a mobile CT lab. Multiple gardens and walking paths have been incorporated for both patients and staff to enjoy. Walking trails connect between our several garden spaces and beyond the site to an existing trail system within Adel.
Our building footprint started with an L-shaped design to hug our site and appear more welcoming to visitors during their approach. From there, we pushed our ground floor back to accommodate our site's slope, and we extended the corners of our footprint to fit in all of our departments. We then subtracted portions of our first floor to allow for a rooftop garden and concealed helipad. We then decided upon our entry points and pulled those out to embrace our visitors and create a more prominent look. To connect staff to daylight and nature, we placed clerestory windows above major work areas. Lastly, we included canopies over our entrances to make them even more prominent and protect our occupants from the elements. Our building program is split into ground floor and a first floor. The first floor contains our clinic, rooftop garden, inpatient unit, ambulance garage, and helipad. Our lower level includes behavioral health, emergency department, diagnostic and lab, nutrition services, building support, and circulation bridging the 2 stories. This plan shows our clinic in the upper left corner, purposely distinct from the emergency department on the lower level. The atrium and roof garden public spaces lead to the inpatient unit, which was placed to maximize views. The helipad is adjacent to the ambulance garage and paramedic courtesy and sits directly above the emergency department and behavioral health department. On the ground floor, the emergency and behavioral health departments are adjacent to one another, with diagnostics and labs centered within the building. The lower level atrium joins the community room and building support, which hosts staff and wellness and nutrition services.
Moving on to the main entrance, we have a large atrium that you are greeted with upon arrival. This immediately draws you in, and once inside, you can take a left to visit the clinic or a right to visit inpatient services. The exterior materials here are brick, metal paneling, and concrete. This provides variety and a unique contrast that changes throughout the day with the play of light and shadow on the protruded bricks.
Through the main entrance, a large atrium features multiple seating options, personal device support and charging stations, and a cafe towards the back. There are 2 points of entry for the rooftop garden that leads to a lower patio and garden space. Large windows provide natural views, encouraging users to go outdoors while letting in natural daylight. Integrating a green wall pulls natural elements indoors. Various seating preferences and group sizes are accommodated to be used by both the patients and visitors. Colors and signage create wayfinding by following the airport model. This provides users with only enough information to get them to the next decision point, lessening patient stress and confusion as they navigate the building.
Our roof garden is next to the atrium, highlighting design drivers of staff wellness and natural views. This is a place to go when patients and staff need a break while also providing access to the lower level sensory garden.
To give independence and freedom to our patients, we provide self-rooming technology. The onstage-offstage model put in place here in the clinic allows for this by concealing staff work areas. To guide patients' self-rooming experience, flooring details wrap the patient circulation of the exam rooms to make it clear where they need to go.
As the patient ventures from the waiting area into the corridor, illuminated signage helps to indicate which room is ready for them to enter. Adjustable height desks stimulate productivity and feature privacy panels. Caregivers have a designated location for quick informal meetings without compromising sightlines. Caregivers are able to communicate with available screens. Staff wellness is encouraged with large windows and lots of natural daylight. Open countertops allow for plentiful workspace while providing lots of under-cabinet storage. Caregiver and patient zones are adjacent to the corresponding doorways for the onstage-offstage circulation, clearly defined by casework placement. Touchscreens can be used by caregivers to help explain medical terms and processes to the patients. Hard surface allocates space for personal items out of the patient's way. Caregivers are at the same eye level as the patient and visitors when conversing. Bench-style seating is able to accommodate multiple visitors.
The inpatient department is located close to the main entrance to provide easy wayfinding for visitors while also being in close proximity to the emergency department for patients who arrive there and need to be admitted. The patient rooms are aligned along the exterior walls of the department with an angled head wall to encourage patient views of the northern landscape. A cornered nurse's station allows patient visibility along with windows at each patient room. Inpatient rooms and high-traffic corridors continue with neutral vinyl sheet flooring to highlight public access. Warm-toned LVT in the corridors leads family members to small nooks where they can step out of the room for privacy without crowding the hallway. The dark LVT divides public corridors from staff-only hallways.
Moving beyond a transitional waiting area, the inpatient rooms are adjacent to decentralized nurses' stations, with a window view into the rooms while also providing a designated space for carts in the corridor, keeping hallways clear for patients, caregivers, and visitors.
Adaptable sleeper sofa accommodates many family members. Angled bed orientation and large window bays encourage the patient to enjoy the wooded views. This adjustable reclining chair is to be used by both the patient and visitors. Vertical storage is perfect for personal items and open shelves allocate space for cards and flowers. A built-in workstation provides family members and visitors a place to be productive during long visits.
Our ambulance garage on the roof of the emergency department allows for quick patient transport down the elevator and adjacent access to the helipad for easy transfer of patients.
The helipad is located on the roof of the building to provide an elevated flat surface for landing due to the site's complicated slope and quick access to the ambulance garage and emergency department.
Directly below the helipad, a centrally located elevator and racetrack model create efficient staff and patient circulation. Our racetrack model is highlighted with LVT flooring that pours into the treatment rooms, while the staff lounge, nurses' station, and other administrative work utilize dark flooring.
Following our staff wellness design driver, a designated area for staff is provided in addition to patient observation rooms. This area is designed to be a check-in for staff where they can talk to a specialist and get a mental health screening. Like the emergency department, high traffic and multi-use spaces in this department are indicated with a neutral LVT.
The emergency department has a separate entrance to provide easy wayfinding and immediate access to ensure swift treatment times.
We placed behavioral health in close proximity to the emergency department in order for critical patients to be nearby essential services.
To allow for staff flow and surge from the emergency department, diagnostics are located nearby to allow short staff travel distances and faster diagnosis. The diagnostic and laboratory offer many important spaces such as radiography, CT, and mammography. Most of the flooring in this department is vinyl sheets for increased cleanability, and few staff spaces reside in this department due to the adjacency to the staff break room. The large hallway adjacent to this department creates an adaptable space that provides various seating for waiting. This space can be easily converted with privacy screens to accommodate for testing or vaccinations. LVT planks show the self-rooming patients where they can pause and wait.
In order to provide better patient and visitor access, the cafeteria is located off the main atrium, while the food storage spaces are located in the building systems zone near the loading bay.
A large multi-purpose room near the lower atrium and waiting hallway provides a space for nutrition classes and other events. To provide an adaptable space, food services are adjacent to accommodate dining services for events.
Building support can be accessed by the service drive for food and medical equipment deliveries. This department is occupied only by staff, so a large staff break room and wellness amenities have been incorporated to allow for natural views and rejuvenation away from the busy corridors and patients. Due to the traffic of carts in this department, general vinyl sheet flooring has been used for durability and cleanability. However, the staff break room and decompression zones are indicated by a darker LVT flooring.
The main landscape on site is located directly off the atrium and roof garden spaces. This planted area allows respite to all users, whether they're staff on a stressful shift or patients waiting for lab results. Plantings provide sensory stimulation, and intimate spaces are inserted periodically along the paths to allow for privacy and quiet contemplation. From within the landscape, visitors are surrounded by greenery, and features such as this labyrinth quiet a racing mind. Plantings provide sensory interest, and pathways encourage exploratory wandering.
The makeup of the exterior materials consists of brick, metal paneling, and precast concrete. In order to add texture and depth to the facade, we rotated every third brick 90 degrees so they protrude outward from the wall. This will add interesting shadows to our exterior throughout the day. We also incorporated metal paneling as a rain screen in order to protect our building from moisture, and although not shown here, we've added louvers to our southern facade as well to protect the occupants from any harsh lighting. Here is a perspective section of our corridor connecting the atrium with inpatient services. As you can see, the louvers are shielding this area from any direct sunlight. A sun study of our southern facade emphasizes the protrusion of those bricks. Staff wellness, patient privacy, natural views, and daylighting strategies drove the design of the Woodview Medical Center, as well as an emphasis on preventative care. Offering flexible, adaptable, and convertible spaces to accommodate future needs will help empower individuals to take charge of their health and create a healthier community in Adel, Iowa. Thank you.